Okay, good morning everyone. Today I have a beautiful patient coming to me from UK for a total facial rejuvenation, and today is 9 days after her surgery where I removed all of her stitches, and it's a final control visit. Let me show to you what we have done. This was a combination of a full facelift, deep plane technique with a temporal lift to tighten the temple. And she also had some implants in her lips that was put 13 years ago. Remove the implants. Let me show you the implants. There you go. These are silicone implants that I removed from her lips. I'm not a big fan of silicone implants in the lips. I always prefer more natural results to using fat grafting. So we did some fat grafting for her. I'm going to show you the incisions. This is almost 10 years after her, 10 days after her surgery. Her incisions are in front of the ear, going inside the tragus cartilage, and behind the ear on the hairline. Inside the temple, we have an intratemporal incision going inside the hair. We have all the staples removed at the moment, and we have an extra incision under her chin, a submental incision. Because we needed a combination of anterior and lateral platysmal work in the deep plane to tighten the neck. That's why she has this extra incision under her chin. I do it in almost half of my facelift and neck lift patients. We have a beautiful cervical line, as you can see here, a cervical angle. I've put some fat in the chin and the pre-jowl, into the mid-face especially, a little bit in the cheeks, very little. Also I put a lot of fat in the lips to compensate for the volume loss that we had after the implant removal, and also to give her some rejuvenation in the lips. The vectors for the facial lift surgery were in this direction in the mid face, in this direction in the lower face, and in this direction in the neck area. To give her a proportional rejuvenated look. You can see that the elevated mid face is contributing to the OG line. And also we have release of the nasolabial creases, and also the marionette lines. She had the deep marionettes and the deep nasolabial creases, and also an extensive jowl here that was very sagging and contributing to the lower face, the lower face and the platysma looseness. This is 10 days after her surgery. She still is in her healing period. It's going to take a few weeks for all the swelling to go away. Most of the swelling usually is with the fat grafting, but she looks fine for the time being. And today's the last day. She's going to go back home.